Hi everyone, and welcome to another episode of Oaktree TV. I'm Dave Kemp, and today we're joined by Dr. Teri Fisher, who is a clinical assistant professor at the University of British Columbia. Teri, say hello.
Hi there, Dave. Great to be here.
Thanks for coming on. So Teri is also the host of the Voice First Health podcast. This is a podcast where he talks all things smart assistants and how they're being implemented into the healthcare setting. I was actually fortunate to go on this podcast on Sunday, where we talked all things hearing aids, hearables, and how smart assistants are beginning to kind of take root and begin being integrated into these devices and the overall implications of that. But Teri has interviewed a number of different people. I was actually the 15th episode on here, so he's had 14 other episodes on here where he's had a number of different interviews. And so, Teri, I wanted to bring you on today to kind of get an idea of what are some of the things you've learned over the course of doing this podcast from all the different interviewees.
Great. Yeah, thanks. So as you said, I've had a chance to interview a number of different experts and thought leaders in the voice first space, and what I found is that there are a couple of, key themes that keep coming out. The first being simply that with voice first evolving so rapidly, we are about to experience what I believe is the biggest technological change since the introduction of the internet itself. And the reason for that is because in the past we've had to use various types of interfaces in order for us to communicate with the computer. So, for example, we had to use keyboards, we had to use a mouse, we had to use a touch screen, and that was because the computing power wasn't strong enough or wasn't powerful enough for us to communicate the way we most naturally communicate through our voices. So we had to adapt to the way computers communicate. Now that the artificial intelligence and the computing power is strong enough, we are able to just speak to the computer. So the computers are adapting to us, and that makes our interactions, our communication, the most natural it has ever been, which is really, really exciting. Another thing that has come out in my discussions, and particularly with you, Dave, just recently, you really highlighted this in our discussion, is that in this voice-first world, people are always thinking about you can now speak to the computer. But the other side of that equation, of course, is that if you're going to speak to a computer and the computer is going to speak back to you, you need to be able to hear what the computer is saying to you. So in this voice-first world, we also need to think about, yes, it's voice-first, but also now we have to be hearing first. And that's a critical component in order to have an effective communication with these computers using this type of technology. And I think one really, really exciting theme that has come out is the fact that because these devices are so frictionless, so seamless, and so easy to use, it's going to allow us to obtain healthcare, receive healthcare in our homes. Because as these devices become more prevalent and more healthcare applications and skills and so on are built on them, we're going to be able to access healthcare information. We're going to be able to connect with our healthcare providers, but through our home. And this is going to create a scenario where people are going to be able to age in place, live in their homes longer, which I think is really, really exciting in terms of pressures on the healthcare system and relieving some of those pressures. So this is a very exciting time for us. I'm very, very, very fortunate to be part of this community and learn about everything that's going on.
Yeah, I can't agree more. That's awesome points. And so, I think he makes a really good point there, talking about aging in place. You think about the patient demographic that you all tend to see, right? The older adults. This is a very powerful technology for these people, allowing for a level of empowerment that we haven't really seen in some time, bringing people that have been sort of left on the sidelines back into the fold and empowering them in that way. So Teri, let me just ask as we wrap up here, over the course of interviewing, who are some of the people that you've interviewed? And then also, where can people find, all this great information that you are generating?
Yeah, well, thanks for the opportunity. Yes, I've been very fortunate to interview quite a cross-section of thought leaders and experts in the voice-first field. People like Devin Nadar from Boston Children's Hospital, where they're doing some incredible work. We've had Bradley Metrock from Voice First FM, who puts on the Voice of Healthcare podcast on the show. We've had Beyond Verbal, who are doing some incredible work in using voice algorithms and inflections to actually use it as diagnostic tools. Ann Weiler, who was the winner of the Diabetes Alexa Challenge with her product SugarPod, and that's just a little sampling of some of the incredible guests that we've had. So it's been a lot of fun. If people want to check out the podcast or learn a little bit more about what's going on, they can simply go to voicefirsthealth.com, or they can connect with me on Twitter. I'm at Dr. Teri Fisher, DrTerifisher.
That's awesome. Well, thank you so much for coming on today. We'll link all of this in the notes, and then we'll see y'all next week. Thanks a lot for watching.
Thanks, Dave.